Okay, we are live on Facebook. And there we go. Good afternoon, everybody. It is Friday afternoon, 2 o'clock, and it is Fertility Talks. We are talking to Professor Siebert. He is from Aevitas Fertility Clinic. Thank you very much for agreeing to join us today and get some of our questions answered around endometriosis. As we all know, this month is Endometriosis Awareness Month, so it is only fitting to make sure that we end off the month with endometriosis talk as well. So thank you very much, Professor. Professor is a fertility specialist at Aevitas Fertility Clinic, and I just like, Professor, if you could just give us a 2-minute background of where you are, what it is that you do and your years of work at Aevitas.
Well, Leanne, thank you for the introduction and thank you for having me today. Yeah, it's a pity that we have it at the end of Endometriosis month because, as we all know, endometriosis is such a horrible disease for the women who suffer from it.
Yes.
It's a game changer. It's a lifelong disease. And, that's part of my work to try to improve the quality of lives of these women. So we are at Aevitas Fertility Clinic in Pinelands. I am a fertility specialist for the last 20 years. I'm doing endometriosis surgery since 2003. So really, this is my game. And the more I do this, the more empathy and sympathy I have for women suffering of this dreadful disease. And we always think that one shoe fits all, but you get just the patients with horrific disease. We had a patient on Wednesday, a young patient, 31, where we removed a part of the bladder, a part of the bowel, a part of the ureter, the appendix. A woman yesterday where we resected about 30 centimeters of bowel. And this is it's just an ongoing story. So, yeah, thank you for the opportunity to have a chat with you, Leanne, and to try to answer the questions of our listeners. Thank you very much.
Strangely, when I posted, I had to let everyone know that you will be doing this talk. I had someone inbox me saying, I don't have a question, but I'd just like to say thank you to Professor Siebert. You actually assisted her in 2015. And she had bad endometriosis and you helped her. So thank you very much. So ladies, if you are listening, please note that Professor is he really knows his stuff when it comes to endometriosis, and you should definitely listen to this. If you have any questions, please put it in the comment section and we will answer at the end. Professor will answer your questions at the end of the talk. So Professor, tell us first of all, what is endometriosis?
Yeah, Leanne, that's a very loaded question. So I don't think that we really understand the disease as yet. Lots of research being done. But the most simplest explanation is to explain by the following pattern. So when a woman menstruates, she sheds the endometrium. So the lining of the uterus is the endometrium. But there are two natural orifices of the uterus. The one is the cervix, so the blood flows into the vagina, or the other one is the tube, where the sperm needs to run through to get to the egg, to fertilize the egg when you want to conceive. So the fluid, the endometrial fluid, can either follow these two orifices, these two passages. So the one is out in the vagina, but the other one flushes back through the tube. And that fluid goes and sit on the outside of the uterus. So endometriosis is when the lining of the uterus, the endometrium, that endometrial fluid, flushes back through the tube and sits on the outside of the uterus. So is it still an answer what it is? No. So practically, I like to use the comparison of a grass burn. So if you've got a grass burn on your arm, it is raw, it's irritated. So if you imagine yourself, I'm putting a camera into your uterus when you menstruate, that lining of the uterus is raw and inflamed. It goes and it positions itself on the outside of the uterus, making that grasping type of lesions. It's raw, it's like a glue, and all the tissue can get stuck to that raw areas. That's why women with endometriosis will have chronic pain, will have pain with menstruation, pain with intercourse, and also the inability to conceive.
Wow. Wow. What are the causes of endometriosis? Is it just, anybody gets it? Is there, a specific person that would get it?
Yeah,
Age group,
so
example?
that's a very good question. So the person sitting in front of me normally asks the question, but why me?
Mm,
Why not my friend? So I'm either genetically predisposed. That's why it's so very important to understand, is there a family member with a disease? Because it makes me more likely to get endometriosis. Or it's the way my body responds to these cells on the outside of the uterus. So I just explained that if you think of the normal anatomy, the uterus, the tube, and the ovaries, if that fluid flushes back through the tube, that should happen to any woman
mm,
who's got a uterus and a tube,
yeah.
but only a specific percentage of women get it. So it's the way my body reacts against those cells, or it's a familial background. But it's just important. This is the most simplistic way to try to explain the cause of endometriosis. There are 4 other hypotheses, and really still we don't understand it. But I'm just trying to make it very simplistic that we understand how the cells get to the outside and what then is going to happen if they are on the outside, and why do certain women get it and others not.
Wow. Okay. How does it present itself?
Okay, so just goes right back to my initial explanation. So if you think that those inflamed cells that's normally on the inside of the uterus is positioned outside, and remember I said you must think of a grass bin. So
Yes,
if that
yes.
raw areas sits on the outside of the uterus, and when you menstruate, it's the same cells that's on the inside of the uterus. So it gets inflamed, it's painful. So you've got pain with menstruation. If it is a big raw area and the ovaries get stuck to it, the bowel gets stuck to it, I can have chronic lower back pain because it's stuck at the back of the uterus. The bowel can get involved. You can have constipation, painful passing of stools during your menstruation. If the ovaries is stuck at the back of the uterus due to the grass bin area, you can have deep pain with sex. And the giveaway for me when I ask these young patients of mine is, if you have intercourse, do you have pain in certain positions, deeper penetration? And if it is yes, then you must start to think, but is there not a reason why there's pain at the back of the uterus when they have intercourse? And then lastly, all these symptoms with the inability to conceive
Yeah.
due to the distortion of the anatomy. So it's a complex disease, different presentations, lots of others too, but I think those are the most common ones, Leanne.
Okay. Is there any specific age where this happens?
Yeah,
Or
very interesting question. So we say endometriosis is ovulation dependent.
yes.
So if you ovulate, you menstruate, and that's why you get endometriosis. The youngest patient I had with endometriosis was 8 years of age from Stellenbosch. She had an endometriosis nodule, a mass of endometriosis in her belly button, and she started to menstruate from the belly button at 8 years of age. I
Wow.
see lots of patients who had hysterectomies for endometriosis, and we then speculate that when you go into the menopause, it should be done. Yes, that's the law of averages.
Yes,
But
yes.
I also do a lot of endometriosis surgery in postmenopausal women who was inadequately operated earlier and still present with pain, and then you
Mm.
get to reoperate. So it's a widespread from an age distribution point of view.
Wow. Is it different severities of endometriosis?
Yes, absolutely. And it's not that everybody's endo is the same. So you get only little spots of endometriosis, little spots which is deeper. Then you get widespread endometriosis and everything is stuck together. And then you really get deep endometriosis when the endometriosis involves the bladder, the bowel, the appendix. It can also affect your lungs. I've got a patient from Durban who monthly, she's got hemoptysis, so she's coughing up blood on a monthly basis. She's got endometriosis in her lungs. So you also get endometriosis on the diaphragm, and they then present with cyclical shoulder pain. So lots of different ways and different degrees and severity of endometriosis.
Okay, what is the treatment options for endometriosis?
Yeah, so you've got to look at two different arms. The one is so you need to look at three, but the one is expectant. You only treat the pain with pain medication, but really it's either medically to stop ovulation, so any contraception, and nowadays we use Visan, which is frequently used. Unfortunately, about 10% of women have quite a lot of side effects, but it suppresses ovulation. And then on the other arm is surgery. But if you look at a young patient, surgery itself is it's not a cure. You've got a 20 to 50% chance that you might have recurrence. So if you remove the endo, you've got to suppress and prevent recurrence. And that's when we use something like the contraceptive pill to prevent ovulation and hence the recurrence of endometriosis.
Yeah, so it would, if someone's dealing with endometriosis, it's like you can that person, because you then obviously can't give them the pill to take the pill because you're trying to conceive. Someone is trying to conceive, obviously. So it does cause a big problem.
Yeah. So you're so right. So normally the young patients or the patients who have completed their families will get the pill to suppress. And if it doesn't work, then get surgery. And then the patient who wants to conceive, get operated. If you do good surgery and the tubes are still okay and intact, and you've got no male factor, your chance to be pregnant within a year is about 50 to 60% after surgery. And that's not just on a mild or minimal endometriosis, that's also severe endo if the tubes were not affected and with good surgery.
Oh, okay. And this ties into it. How does the endo affect your fertility? So I think you answered most of that, but you can continue.
Yeah, but let's just briefly again. So just the one most simple example is if those ovaries or the tubes are stuck at the back of the uterus, the tube can't catch the egg. I like to use the analog of if your hands are tied behind your back and somebody tosses a ball to you, you can't catch the ball.
Yeah.
That's exactly what happens with the endo. That raw areas pulls the tube away from the ovary, and it prevents then the ability of the tube to be able to catch the egg.
Oh, okay. If you think you have endo, where would you start, or what would be some of the symptoms that would present? When you know, like, okay, now I need to do something. Where do you go? Where do you start? Who do you see?
Yeah, so as I said, if you have the triad of symptoms, painful menstruation, painful intercourse, chronic pelvic pain, plus the inability to conceive, most likely, more than 50% you have endometriosis. I will then go to your gynecologist and then ask, do you do a lot of endometriosis surgery? If not, then ask to be referred to somebody who does a lot of endometriosis surgery. Because endometriosis surgery is very much the success is obviously then surgeon related, and your chance to conceive will obviously be surgeon related. So it doesn't mean your general gynecologist can't do it, but it depends on his ability, and you must ask those questions.
Okay. Then I've got a question here from one of our viewers, and they ask, what after surgery, when is the soonest before you can start trying again if you have endometriosis?
As soon as your wounds are healed and you are feeling okay. So there is no, the inside of your pelvis is healed within 10 days, maximum 2 weeks.
Oh.
So yeah.
Okay, thank you, doctor. I think that I don't have any other questions, and I'm sure always as soon as we end the video, then all the questions start coming through. But if you would like to get hold of Dr. Siebert, you can contact Aevitas Fertility Clinic. I will have the details on the screen as well. I'll put it up later. And then I think I've got a newfound respect for women dealing with endometriosis. I always thought PCOS was bad, which I suffer from, but I mean, endometriosis is just another level. And so we say, like, you know, I'm so sorry that they are dealing with this, but thank you, doctor, for helping us and talking to us.
Leanne, thank you very much. Just something to end off with. I have seen a patient 28 with 7 laparoscopies here in Cape Town. So for everybody who has got endometriosis, there's a very important point to remember. Endometriosis is a lifelong disease. It is treated by 2 modalities. Medical, which you have said, the contraceptive pill, for example, and surgery. And the main aim is to avoid unnecessary operations.
Yeah.
So if you start having a second or a third operation, you've got to ask your doctor why. Because there's no value in it to do recurrent surgery, and your problem is not sorted out. So I think that is a very important point, and you've touched on it. It's a lifelong disease, and we need to look at a lifelong solution and not just a single operation.
Yeah, and that is what I try and promote, and that's why I actually do. I run Fertility Solutions. Is my issue was when I was dealing with infertility, I kept running back and forth to a doctor, from one doctor to the next, to the next, to the next, having all these different types of surgeries. But I wasted such a lot of time, such a lot of money, such a lot of, you know, running back and forth, where you could go to proper fertility specialists from the start. And I think my story would have been a whole lot different. But at the time, you know, I didn't know, like, oh, this is where I can go to, that's where I go. So that's why we're trying to educate women and say, these specialists are there because they know what they are doing. So do yourself the favor, save the time, the money, and all the heartache and everything by going to a fertility specialist from the start and seeing, you know, those are the people that actually know what they're doing. So thank you very much for that, doctor. Thank you. Have a great day.
Thank you very much, Leanne, and I hope you've got a good weekend. And to all the listeners, enjoy your weekend.
Thank you very much. Bye.
Bye.